Coming up on this episode of Common Denominator.
The average adult is going to need around like 7 to 8 hours to have optimal neuropsych testing. Like we test where cognitively do they function the best. It's going to be in this Goldilocks zone. It's not less than that. It's not more than that.
Hi, and welcome to Common Denominator, where we focus on human connection and what brings us together. I'm Moshe Popack, and today, something so many of us can relate to, how to get a better night's sleep. My guest is sleep expert and neurologist Dr. Meredith Broderick, aka the Sound Sleep Guru. She's a triple board certified sleep doctor who treats sleeping problems holistically and customizes sleep plans to minimize the use of medications. If you're one of the 70 million Americans who suffer from chronic sleep problems, this episode is definitely for you. Before we play the interview, a quick reminder that if you like the show, please subscribe and follow me on social media at @mpopack. Now, here's my conversation with Dr. Meredith Broderick. Enjoy. Hi, Dr. Broderick, and welcome to Common Denominator.
Thank you so much.
So I saw a recent stat that, there's 330 million people in America, and 70 million of them, which is over 20%, have a chronic sleep problem. Why do you think that is?
Well, I think sleep is something that happens to all of us. So it's, as a starting point, it's something we all deal with every day. It's a basic need of our bodies. And I think with the way the world has changed very dramatically with electricity and 24-hour society and technology, that it's just become very common for people to have disruptions.
Yeah, did you see that, you talk about society, we're moving so fast, obviously, with technology. Do you find, I know I speak to different people, they recommend even to not even have a TV in your room, and even to take your cell phone and kind of put it outside of your room. Is that actually accurate? And what's the correlation to your sleep?
Yeah, absolutely. I mean, I think that for one thing, it's the ubiquity of light in our environment, and that is very unnatural if you think about most of human history, where when the sun goes down, there really is not a lot of light. There's the moon, and you might get a little bit from depending on the time of the month with the moon, you might get more or less, but really there's no other ambient light. And so having anything that's light producing after the sun goes down is very unnatural. And it actually turns out it's a very potent part of our sleep-wake system. And so it has a dramatic effect and an impact on sleep quality. And then also when you're dealing with something like, an iPhone or a TV, there's noise, there's stimulation to the brain that kind of keeps a little light on.
I always thought about this, theoretically, right? There's 24 hours in a day. And 8 hours of that day theoretically is in our bed, supposed to be sleeping. And I always say that I could probably be the best spokesperson to get a good healthy mattress, a good pillow. How important is like your actual physical sleep setup, the type of mattress you have, the pillow, the sheets? Does that add to the quality of sleep that you have?
Yeah, I mean, I think of it like this. I don't think it's an absolute necessity to, enable people to be a good sleeper. I mean, let's look at different societies where they don't have these fancy products and the people don't have sleep disorders. But can it be icing on the cake? Can it be sleep enhancing? Can it help compensate where there might be other things? So I do think it's important. I do think it's something to look at for my patients, like case by case. How could this help you? If you're someone who has back pain, if you're someone that has trouble with pain, discomfort, things like that, you have trouble with, temperature regulation, those things are going to be much more important for you.
And what are some of the causes of poor sleep that your patients deal with?
I kind of like to separate it into there's medical issues and then there's more of like what I would consider lifestyle issues. So from a medical standpoint, I think the other reason we're seeing a lot more sleep disorders is because of, an obesity problem and because of lifestyles that we're seeing where people are more sedentary, they're more overweight. We think that the change in our diets with agriculture and processed foods have diminished the healthy jaw development and bone growth in our jawbones so that our airways are more restricted, which predisposes us to things like snoring and sleep apnea. And then I also think that we're just increasingly stretched in terms of what we want to accomplish during our day, trying to go 24/7. I think, our culture is very kind of goal oriented. I think it's sort of normalized to be very stressed. And that's kind of regarded as almost a good quality, right? If you're, kind of burning the candle at both ends, you're a hard worker, you're ambitious, you're motivated. And I think sometimes it's hard for people to kind of balance it all.
I know that there's two ways, when it comes to treating any problem. You can go kind of like the Western with medication, which just deals with the thing right in front of you. And I know that you're more of when you're treating your patients more holistically. So in regular, I guess, American medicine, if you want to call it that, what are some of the methods? And then I'll go to kind of the methods that you use holistically, just to like juxtapose the two. What are some of the methods that regular American society uses to treat different sleep disorders?
Yeah, so the biggest one is going to be pharmaceutical agents that are, everything from a sleep aid to an antidepressant to alerting medications. So those are the main things. Sometimes people do truly have like a medical disease, let's say Parkinson's disease, for example. Pretty much 100% of those patients are going to have sleep problems. So again, there are medications specifically for treating Parkinson's disease that we might use and would be very important to improving sleep in that patient population. On the medical side, the mainstream of sleep medicine, there's also a field called behavioral sleep medicine, which I practice as well, that has behavioral intervention. So something called cognitive behavioral therapy for insomnia. And so that might bridge the two. People might see that as more holistic, but it is part of Western medicine. It's very well studied and validated. And then I think, there are the other things like the CPAP machine, there are orthodontic devices, there are surgical procedures, there's type of speech therapy called myofunctional therapy that we use. So then those are actually all sort of mainstream Western medicine. Sleep does have that kind of, I think, a more holistic approach if with the right practitioner.
Right.
So some of the more holistic approaches, though, might include using complementary medicine as well. So things like acupuncture or massage therapy, meditation. And so I do try to incorporate and kind of customize to my patient their receptivity to that.
If you're just joining us, you're listening to the Common Denominator podcast. My guest this week is triple board certified sleep expert, Dr. Meredith Broderick. She's offering crucial tips to improve the way you sleep and help you feel more productive, more energetic, and more focused throughout the day. Next week, I'll chat with Dave Azer, a TV host, lifestyle correspondent, and most importantly, a guy who was pregnant for a weekend, sort of. Dave's wife, Lindsay, was 7 months pregnant with their second child when she pointed out to Dave that he wasn't being empathetic enough. Side note, she was right. So they agreed he would wear a pregnancy belly for a weekend to get a sense of what women go through. Make sure to subscribe so you don't miss it. Now, back to the show. Myself, as having 10 kids, just last night, my 2-year-old was crying. My wife brought the baby into the room, and she literally had to get up. He's sitting there snoring. So I'm thinking, maybe today I would ask you, for a child or an adult, let's just say a child, for the child that they shouldn't snore, or for the adult how they can, maybe advice to, I know a lot of nursing mothers, they keep their baby in the bed for maybe a bunch of years. So maybe for the baby and for the mother, maybe some practical tips and ideas how to get better sleep.
Yeah, so I definitely would separate out children from adults in terms of looking at this type of thing, snoring in particular. And during infancy, so like those first, let's say the first year of life or the first 2 years of life, when, I think children are more likely to be nursing, it's very, very personal and very, very cultural, whether a woman or a family decides to co-sleep with their child. Now, we know because of sudden infant death syndrome that we don't recommend it for the first year of life because it's a risk factor for sudden infant death syndrome. So you don't recommend it. But some women, use a little bassinet, or, they have a little contraption where they can just put the baby next to them. But one of the, if you look at traditional Western medicine, we don't typically quote unquote recommend co-sleeping mainly because it seems like the child and the adult don't sleep as well. The quality of the sleep is diminished. And then also just like, and this is my personal opinion, I'm not saying co-sleeping is bad or it's harmful, but, you start to think about long-term, there's a point where most parents want to train their kid to sleep in their own bed at some point, right? Even if it's just for the intimacy between the two of you, or to have, a separate space for with these boundaries. And so you kind of have to think about working your way towards that. And I think the transition to that becomes harder the more the child has been trained to sleep in the parent's bedroom. We do recommend actually that the child sleeps in the bedroom for the first year of life, but not in the bed, if that makes sense.
Sure.
Because we want the parents to hear the child if there's an issue, but we don't want the parent to sort of be able to roll over on the child or smother the child. As far as snoring, we consider that to be pathological in a child. We don't think that children should snore a lot. Now, if the child's sick, that's different. But when a child is snoring a lot or very consistently, a 2-year-old, we wonder about things like allergies. We wonder about whether they're, mostly what we want to know is if they, have large tonsils and adenoids, if that would help. And we want to know about the quality of sleep. So it's not that we necessarily need to do anything about it, but we want to sort of flag it and see how things develop. There's a lot of growth and development in the airway at that time. And we want to make sure that we kind of follow that, because we know that if kids have snoring and they have noisy breathing, it's a risk factor for sleep apnea. And it's not life-threatening. It doesn't mean your child's going to have any major problems, but we look at these things over time and we see these kids have better learning, they have better attention, they have less mental health issues when they're older if we address these things. So that's what we like to take a look at. And so sometimes we'll do a sleep study where we have them come in and actually monitor their breathing and their oxygen levels and their carbon dioxide levels. But I think we want to, have a child like that assessed to see, kind of put that on a spectrum of how big of a problem it is. Do we want to just monitor it, or do we want to test, and do we want to do something about it?
Yeah, and I think that's very important. What you mentioned, that was foundationally, right? If the child is snoring, the quality of sleep is not as good. Therefore, how can you expect them when they go to school that their brains are absorbing as much information as they can? So, you want to go to the root cause of things. I always say that. And in general, let's just take an adult. What would you recommend? I've heard different studies. How many hours of sleep would you recommend for an adult?
So, the average adult, let's say the average adult who doesn't have any major health issues is going to need around like 7 to 8 hours to have optimal neuropsych testing. Like, we test where cognitively do they function the best. It's going to be in this Goldilocks zone. It's not less than that. It's not more than that. And if it is, then it's possible that these people are outliers, that they have these unique genetic characteristics where they don't need as much sleep or they need a little bit more. we call them short sleepers or long sleepers, but most of the people are going to fall in the middle of that bell curve where 7 to 8 is going to be optimal for them.
And then I heard this concept called REM cycles. What's that? What's that concept? What does that mean? And how many of those kind of cycles do you need a night?
Yes, so we have 4 sleep stages, and we cycle through those stages. So it's non-REM 1, 2, and 3, and then REM. And we cycle through those about every 90 to 120 minutes per night. And the nature of the cycle changes. So at the beginning of the night, we have more stage 3 deep sleep. And towards the second half of the night, we have more of our second deepest stage, REM sleep. So there's a certain pattern, we call it sleep architecture, that we like to see. And so, I want to see someone cycle through REM, 5, 6, 7 times. It can vary a little bit, based on the person, but that's what I want to see. And there's also a pattern I want to see too, with each sleep cycle.
And one of my favorite things I always love seeing, like in Italy, or let's say I'm in Europe, it could be 3. They call it siesta, right? Mm-hmm. And I said to myself, I'm like, what a great idea. We always go in America. You always see people 3, 4 in the afternoon. They're always sitting with their cup of coffee, and they're getting their jolt. I was like, why can't you take an hour and take a nap? And I just found that just makes so much sense. What are your thoughts on that? On kind of mainstream napping in America? Do you think we should advocate for that? Do you think that's a good idea?
I do think that napping is part of our normal physiology for many of us. If you look at human alertness across a 24-hour time span, you'll see that our brains have a dip in our alertness in the afternoon. And that can be, after lunchtime. Some people attribute it to eating, but it's sort of the circadian or this timing feature of our normal physiology. Now, some people, for whatever reason, it's probably genetic, they're not nappers. They aren't going to nap even if they are given the opportunity. But many people would benefit from it, and their sleep pattern might change a little bit. In other words, they might, I don't know if you go to some of those countries where they have siesta, they eat dinner a lot later too. They stay up later. So, in general, and so it changes things a little bit, but naps can be very performance enhancing for certain people. So I do think we should normalize it. It's not probably for everyone, but I think we label it culturally in a negative way in this country, in our culture.
Right. As I know, like for me, I have this kind of app that puts you in this kind of deep trance, even though it's 20 minutes. And whenever I do it, it's amazing. It's really, so obviously, like we're saying, all these electronics and all these things that are going on during the day, it's like, how do we, in our mind as Americans, we're thinking like, oh, how do we bring down that energy and shut down? But I guess you just sit down on the couch and just, right? Because then the quality, remember that, it's quality over quantity, the quality of work product, or whatever you're doing, personal life or business, I think it becomes exponential. So I'm a big advocate for that. And I have different friends also that kind of on a regular basis have, they deal with nightmares. Is there a strategy how to tackle that, that shouldn't happen?
Yeah, it depends a little bit on the context, but nightmares are often very commonly tied to either post-traumatic stress syndrome or stress in general or anxiety in general. And so there is actually a medication, it's a blood pressure medication called prazosin that is a game changer for people who have, very frequent nightmares. It works really, really well. And it just kind of blunts that fight or flight that's turning on. And then there's also a type of behavioral treatment called imagery rehearsal therapy that's usually administered by a psychologist or someone who specializes in behavioral sleep medicine. And that can be very helpful as well.
Yeah, and I'll tell you, I just want to go back for a second because I was just thinking about this, about, a lot of my kids, my wife would read this book about kind of the crying out method, kind of around 9 months, and it was just devastating for me. It was like, you put the baby down, baby's fed, baby's changed, baby's good, and I just wanted to see your opinion about that. And then it was the first night, baby would cry for 45 minutes, second day is 30 minutes, and then 25, and by fourth or fifth day, the baby's basically sleep trained. Do you
Mhm.
see any negatives in that? Kind of what your thought is on that?
No, I mean, I'm very supportive of that method, but at the same time, I do understand why a lot of parents struggle with that. And I think there's a balance, and there are also some middle grounds between, kind of the extreme cried out and something more, um, something more graduated. I think, I have a 4-year old, so I've been through this not not pretty recently, where um, I can see more nuance with it, because it is so important to acknowledge to our children that we hear them, their distress, and to want to tend to them. But I think we also have to see ourselves, and this goes into other avenues of our children's lives outside of sleep, as they gain more independence and more skills of, I think of the cry as a question. Am I okay? Am I okay? And I think, it's important for us as parents to be able to reassure our children, hey, you are okay. But I think it's also important for us as parents to say, we don't need to do anything about this. You're uncomfortable. This isn't necessarily what feels right, but I'm going to teach you and I'm going to show you through this sleep training that this is what is best for you. And that's how extinguishing that sort of reaction where they cry and then the parent is distressed and you're anxious because you're like, oh no, something's wrong. It can reinforce that cycle. So I think it's also important to have the awareness that when you're not responding to your child's cry, or you have responded to it, you've made sure that their diaper's dry, you've made sure that they're fed, you've made sure nothing's bothering them in their environment, the temperature's good, nothing's in their crib, that you can reassure them by saying it's okay to cry because you're fine. And by not responding, it's a way of signaling to your child, you're fine. This is okay. So I think of it that way, but I can understand that it's not for everyone. But we do, in sleep medicine, we do see that as a very effective way of training a child to self-soothe, to understand that it's safe and healthy to learn to sleep independently. But again, there's a cultural component to that, and it's not for everyone. And I'm not saying it's the only way.
Right, because I know in general it's always a reflection of us, my wife and I. Whenever we're settled, it's like a reflection onto the kids. You'll see they're just a mirror. They're just like, oh, like they would even in certain manipulations, certain things that they would do. If I give them no energy, whatever, doesn't really matter. But if I'm not settled in myself, then you'll see their reaction is just a complete mirror. So it's always the internal work, I find. And I know also you have a new product, a facial cleanser.
Mm-hmm.
Tell us about that, and what was the idea behind the product?
Yeah, so I see a lot of people who have a medical condition called obstructive sleep apnea, where their breathing in their sleep is abnormal. Usually they're snoring. Sometimes they just wake up a lot or have non-refreshing sleep or daytime sleepiness, and they have to wear a breathing machine at night. And many of them would not clean their masks or clean with things like Clorox wipes or dish soap, or things that really aren't meant to be put on the face. And so after so many years, I just decided, okay, look, we've got to have really healthy skin for this thing to work. It's basically a curative treatment if a person can use it. But if they're, getting skin irritation and skin breakdown, then it's not going to work for them. So I formulated this product with a skincare chemist that has these ingredients that help strengthen the skin barrier. And it has something called calendula, which is a marigold extract. It has natural, like, antifungal, antibacterial, anti-inflammatory properties. And it also just serves as a really nice sleep ritual for these patients, or anybody really, to just have a bedtime routine, which a lot of us don't have anymore. A lot of us are just kind of like working until, like, we're on our phone, checking our email until the minute we get in bed. And so I just thought this is a nice way to, kind of kill two birds with one stone, right? There's a sleep ritual, so there's a behavioral sleep component. There's helping me with a medical treatment that I need. And then also it's just nice to have healthy skin.
Yeah, I'm a big fan of habits and rituals. Tony Robbins talks a lot about that. You just make it. You just being so self-aware, and you make that part of your day. And that's just what you do. That's what you do. There's no good or bad about it. It's not about how you feel. This is your habit. This is what you're doing. So good luck. Definitely good luck with that.
Thank you.
Something I ask all guests, and what would you say is top of the mind that you're most grateful for?
I'm most grateful for my health. I think that being healthy, it kind of sets you up for everything, right? So I would say that's probably number one for me.
Yeah, we've gotten that a lot, and I'm definitely in that bucket for sure. And just something, whatever comes to your mind, something that people don't know about you.
I spent most of my 30s learning how to climb big mountains and technical alpine routes, and I've climbed some of the biggest mountains in the world, like Mont Blanc and Denali and Aconcagua, some of the seven summits. But I've also done a lot of technical rock and alpine climbing too.
So what do you think? I mean, that's fascinating, by the way, because I've seen, I guess, what is it called when you don't have the kind of harness and you're climbing free? Was that free climb, basically, right?
Yeah, free solo climbing.
Free solo, yeah. I've seen that, and it just it like shocks me to the core because you do something wrong, that's an issue. I'm just curious. What are your thoughts on that? On the free solo?
Yeah, I mean, I think that it's incredible. I think it's inspiring. There's actually a woman named Steph Davis who is a famous free solo climber, maybe a little bit before Alex Honnold's time. That I went to one of her clinics and kind of spent some time with her and have read a lot of her books. And I understand it. I think it's amazing. And I understand why people do it. And I think it's not for me. Certainly now that I have a child, it's not for me, but I do get it. I think, we all take different risks in our lives. I mean, some of those people I've heard Alex Honnold say, his dad died of a heart attack, right? And it's like, we're all going to die and we all get to decide how much risk we want to take. Some people are taking a lot of risk by eating unhealthy and being overweight. And, that's sort of normalized in our society. Whereas, climbing free soloing might be looked down upon. There was a recent death of one of the North Face team, Hillary Nelson, and she's a mother. And I remember when I saw her death was announced, she was climbing K2 just like a month ago. I remember just kind of feeling angry at her as a mother. But then when I thought about it more, thinking, I'm judging her because she's a woman. That's not a characteristic in a woman that we really admire the way we do in men. And that goes way across like every culture. If you look at even something like, the book, The Odyssey, Odysseus, and there are many quotes about that. He left his wife, he left his son to go fight a war. And he was a hero for doing that. And I think it is heroic in a way to go do these risky pursuits that further what humans are capable of doing and are inspiring. And I have to say there needs to be a place for these people. And I personally admire it, but I don't think it's for everyone. Yeah,
I'm a big fan of pushing and showing the world by example what's possible. So, it's right. No judgment. I understand it. And I always say this is that we journey alone and we all arrive together. So, but I want to really thank you. Really, really amazing time we spent together. And how can people find out more about you, follow you on social, and be in contact?
I am on Instagram pretty actively at Sleep Dr. Mare. And then my website is www.soundsleepguru.com. And I do see patients in California, Alaska, and Washington State.
Thank you so much. Thank
you.
Hope you enjoyed my conversation with sleep expert Dr. Meredith Broderick. Next week, I'll chat with Dave Azer, a TV host, lifestyle correspondent, and most importantly, a guy who was pregnant for a weekend, sort of. Dave's wife, Lindsay, was 7 months pregnant with their second child when she pointed out to Dave that he wasn't being empathetic enough. Side note, she was right. So they agreed he would wear a pregnancy belly for a weekend to get a sense of what women go through. Please subscribe to the show so you don't miss an episode, and follow me on social media at @mpopack. Have a great day, and I'll talk to you again soon.